especially after you pass 50, when your body changes, desires change, and confidence sometimes quietly slips away without warning. Today, I want to open a conversation often hidden in whispers, but one that's incredibly important to our understanding of the connection between health and the development of our sex lives, especially as we age. This isn't just a lecture. It's an invitation to approach our own bodies and our partner's bodies with curiosity, compassion, and respect. Regardless of your age, background, or relationship status, this conversation is for you. Is swallowing vaginal fluid during oral sex safe? What affects its taste? Is it a sign of health or a cause for concern? Today, we'll approach this issue not only frankly, but also with scientific clarity. Vaginal lubrication is a complex biological response, not simply moisture. It's a carefully coordinated blend of secretions designed to prepare the body for intimate connection. It reduces friction, protects delicate tissues from minor damage, maintains the vaginal pH, and supports the local immune system, all crucial for comfort and safety during sex. Even beyond reproductive age, vaginal fluid continues to be an important indicator of sexual health. In fact, its presence and changes can tell us a lot about hormone levels, moisture, stress, and potential infections. There are three main factors that contribute to this natural lubrication system. First, the Bartholin glands, located near the vaginal opening, secrete lubricating fluid during the initial stages of arousal. This fluid acts as a natural lubricant designed for comfortable, friction-free contact. Second, we have the sebaceous glands. These glands become more active during deep sexual arousal and may be involved in female ejaculation in some women. Finally, there is the cervix, which produces its own mucus, varying depending on the menstrual cycle. Now, let's discuss a topic rarely discussed in detail medically. That's the smell of vaginal discharge. These factors are influenced by many internal and external elements. On the other hand, compounds like sulfur in garlic and onions, or the acidity from coffee and alcohol, can lead to a stronger, more pungent odor. Hormonal changes also play a significant role. Around ovulation, vaginal discharge tends to be thinner and more neutral. Menstruation can produce a slightly metallic smell due to the presence of blood. After menopause, decreased estrogen levels can cause vaginal discharge to become thinner and slightly more acidic. However, sometimes these fluids can signal something else, such as an imbalance. Now, let's turn our attention to the main question. Medically speaking, is swallowing vaginal fluid during oral sex safe? The short, evidence-based answer is yes. In most cases, this is safe for healthy individuals in monogamous relationships who do not have sexually transmitted infections. Vaginal discharge mainly consists of water, amino acids, minerals, enzymes, lactobacilli, beneficial bacteria, glucose, and lactic acid. In fact, from a microbiological standpoint, they are generally less risky than shared activities like deep kissing or sharing eating utensils. However, and this is crucial, these fluids can carry sexually transmitted infections, STS, just like semen or blood. Common ST is such as chlamydia, gonorrhea, herpes simplex virus, syphilis, and HIV can be present in genital secretions, even in asymptomatic individuals. While the risk remains relatively low, especially for viral transmission like HIV through oral genital contact, it is not zero. So what do we do with this information? We combine love with wisdom. True intimacy is not just physical. And that starts with open conversations. Be aware of your own and your partner's sexually transmitted infection status. I recently worked with a patient in his 60s who had just started dating a new partner. After intimacy, he noticed his gums were bleeding and worried about HIV exposure. I reassured him that the risk was low, but also advised them both to get tested together. The results were both negative, but what was even more powerful was the emotional intimacy that arose from that shared experience. There was more communication, trust, and confidence. Safety has made relationships stronger, not colder. if you are starting a new relationship or even trying to rekindle the passion in an existing one, here are practical steps to protect your health and deepen your bond. First, talk about sexually transmitted infections early and make it the norm. Testing is simply another way to care for each other. Second, consider using latex-free protection like dental diaphragms, especially in new relationships. They are discreet, effective, and increasingly widely used. For sexually active adults, testing once or twice a year is ideal, when both partners are clear and free of infection. Swallowing vaginal fluid during oral sex is not only safe, but can also become a meaningful gesture for many women. It's a signal that says, "I completely accept you," and that message can bring profound healing. It's important to make this clear. A woman's natural smells, tastes, and secretions are not a defect. If something smells or tastes slightly different, don't mock, don't shy away, and certainly don't joke about it. Instead, aim for compassion. Offer to shower together, encourage adequate hydration, and open up to conversation. A relationship that respects these realities is a thriving one. Acceptance goes beyond tolerance. It's affirmation. It says, "I see the whole of you, and nothing scares me." And when a woman feels that level of security, intimacy can become deeper, more emotionally connected, and more physically satisfying. According to neuroscience, that kind of emotional security is one of the most powerful enhancers of arousal and orgasmic potential. Your intimacy deserves it. Finally, I want to emphasize something that modern science increasingly confirms. Compassion, kindness, and acceptance are the most powerful stimulants. They activate oxytocin, the bonding hormone, which no medication can completely replace. When men learn to be gentle with themselves and their partners, their bodies and emotions naturally harmonize. Age doesn't take away the capacity for deep love. The only things that can do that are ignorance and unnamed fears. And when you choose to learn, listen, and change, you're not just improving intimacy, you're upgrading the entire quality of your relationship and your life. At a certain age, men realize that true strength doesn't lie in proving how good they still are, but in their ability to understand, accept, and deeply connect with the person beside them. Intimacy isn't a competition, nor is it an obligation to fulfill. It's a safe space where two people can be themselves. What you heard today isn't meant to make you anxious, nor to compare the past to the present, but it's shared to remind you that age doesn't diminish your value. It simply invites you to embrace a more mature way of loving. When you change your perspective, when you prioritize respect and compassion over technique, intimacy doesn't weaken, it deepens, strengthens, and becomes more genuine. Even on topics you once thought were too late to talk about. It's never too late to become a man who knows how to listen, understand, and love properly. If this video helped you see intimacy from a new perspective, please like it to spread this positive message to other men. Subscribe to the channel to continue receiving scientific, honest, and humane insights on men's health, relationships, and quality of life as age changes. And if you feel ready, leave a comment. What was the thing that made you think the most after this video sometimes? Just one question can open up a big change. Individuals with serious health issues such as endocrine disorders, cardiovascular disease, diabetes, sexually transmitted diseases, depression, or those taking hormone-affecting medications should consult a specialist before making any changes to their intimate life. If you or your partner are experiencing persistent pain, discomfort, severe anxiety, or a complete loss of interest in intimacy, these are signs that require thorough medical and psychological evaluation and should not be endured in silence.